Welcome to the 5 a.m. podcast, where we bring you insightful conversations with thought leaders and influencers who are making headway and some waves in their industries. Today, we have George Massengill, the president of Reach United, a nonprofit organization launching a national campaign to dramatically reduce overdose deaths and improve access for quality treatment for those battling addiction. George brings a wealth of experience to this critical mission as a successful entrepreneur in the healthcare sector. He has founded several and led several companies dedicated to substance use disorder treatment and recovery services. Notably, he established the wellness centers, which offer outpatient and housing solutions across his state. With a unique blend of healthcare entrepreneurship and technology experience, George is now leading Reach United's effort to combat the opioid crisis and save lives across America. George, thank you for joining us today.
Thank you, Michael. Thanks for having me.
Yeah, it's great to have you on and to make your acquaintance. We're looking forward to hearing more about Reach United's important work. Can you explain the main mission of Reach United and how it aims to specifically address opioid and the fentanyl crisis?
Yes, thank you, Michael. Yeah, absolutely. We have assembled a team, I guess you could say, that I would say experts in the field of addiction and mental health and dealing with these kinds of issues, along with a group of very successful political folks who have navigated some presidential campaigns as well as governors and know how to work in that space. So we put a team together to go out and try to reduce with the opioid abatement councils or trying to convince and work with opioid abatement councils around the country on how to spend the opioid abatement money. Mm-hmm. And our main two focuses, with several, but primarily is in a public platform, that being Naloxone and OpV and things like that, where we can get those out into convenience stores and those kinds of things, and then advocating for more beds, short-term beds, respite beds, to get folks off the street who are asking for and wanting treatment. And we have several other things we're doing, but the primary focus at 25, we just launched a call to action in D.C. We had the former Surgeon General, Jerome Adams, was with us, who's on our advisory board. And we put together a call to action, which was to spend 25% of all opioid abatement monies that have been awarded nationally, but then to the states, on overdose reversal drugs, Narcan, OpV, Naloxone, drugs that Patagus has, until the overdose death drops by 25%.
Wow.
So that's our focus. And
Good. And so can you explain a little bit about where the opioid abatement money comes from?
The opioid abatement money was won in a lawsuit against a multitude of companies that were, I guess you could say, convicted of helping start this epidemic by having pain clinics and things like that with opioid. A Sackler family was one you're very familiar with, but there's a lot in that settlement. Right. And that was one in a lawsuit, and they were required to pay a substantial amount of money in at the billions, high billions, into the federal government, which in turn has allocated that out for the states who participated in the lawsuit. And so each state, it generally has an opioid abatement committee that is deciding how to distribute that money. In some states, there's actually a state agency deciding how to distribute that money. But overall, that there's a large pool of money that was never there before that has been one, I guess you could say, somewhat on the backs of all of the kids that got involved in opioids and passed away.
Yeah. Now, we were talking about these other drugs that could be used to prevent overdose and things like that. Do you know if there's any holistic, maybe plant-based approaches? I was thinking of this drug, or not a drug, it's a plant called kudzu, and it helps to reduce alcohol consumption and cravings by affecting neurotransmitter systems in the brain. And I'm just wondering if anything like that has come across your desk.
Michael, there's a lot of new things out there in terms of, I guess, once somebody is headed towards recovery, things like Suboxone, Subutex, on and on and on, Brixadi. And there's a lot. I mean, we could go through a list of a ton of things, and probably there are some things like that are out there that are successful. But I think our focus today for reach is primarily on the overdose side.
Gotcha.
So what we believe is where we really need to attack things today is we have a lot of really well-intentioned folks who are trying to help and distribute overdose reversal drugs through the normal channels, health departments, et cetera, for the most part. Some states are a little different, but let's just say for the most part. Our belief is we need overdose reversal drugs in a mainstream environment. We need vending machines. We just started a vending machine program in Tennessee. And not only do we need to put vending machines at convenient markets where people are going in to get a Red Bull, get some, they're going to be more likely to pick up some type of overdose reversal drugs. But we need to begin to have public figures or celebrities endorse the need to carry overdose reversal drugs. And in Tennessee, we just put up our first billboard, and it's one of the Tennessee Titans football players. And, he's basically saying, hey, I carry an overdose reversal drug. You should too. So that is really the focus for us initially, because studies have shown we probably have about a third of what we need on the street today. That doesn't necessarily mean that states have failed or something's terrible. But what I'm saying is in the hands of people, everyday people, that may drive up on a situation, a soccer mom who would say, well, I have no need to carry, naloxone. But yeah, you do. What if you pull up at the soccer match and some 23-year-old male or female has fallen, is right in front of you in the parking lot and dying? Well, if you have naloxone, 2 squirts up the nose, you've brought the person back to life. So we feel like knowing that we have a drug that will save a life of someone who is dying if they don't get the drug is the first thing we need to do in this country.
Yeah. That sounds like it's really bringing the community together to be responsible. Can you tell us how maybe your neighborhood or your state has changed due to opioid use, or maybe even fentanyl?
Yeah, I can tell you firsthand. I have a family member. I have a son who's been in jail for a while, just getting out, going back to treatment for multitudes of time, and has had 20 overdoses. 10 of those would have been fatal without naloxone. But what's interesting is a 6'8" All-American basketball player out of high school, private school, played on a AAU team, a travel basketball team, 14 kids, kind of the best of the best. All of them headed to, major colleges when they got out of high school. Those 14 young men got involved with a pain clinic in West Knoxville that is now shut down. The doctor's in prison. but they all, without knowing, without really understanding the complexities of what they were doing, they were doing things they shouldn't do. They're smoking pot and doing things right, but they began to trade drugs with this person, and they got involved in this pain clinic. 6 of those boys are now dead. They're overdosed.
Wow.
And so, you know, when you begin to look at the reality of that, and you look at 300 people dying a day in the United States of America every day, 7 days a week, 11 people in the state of Tennessee, 5 of which are on a waiting list trying to get help, all mostly under the age of 30. You know, I've been in the treatment business for 37 years almost. And, you know, 25 years ago, I could walk into a room of 100 people at a restaurant or whatever, and I could say, you know, how many of you folks know somebody who's overdosed on drugs? I'm going to say out of 100 people 25 years ago, 1 or 2 hands might go up. If I walked in a room, if I walked in the First Baptist Church in downtown Knoxville on a Sunday morning and said to 500 people in that church, who knows someone who has overdosed on fentanyl, or knows a family member who suffered with that in their family, I would say 95% of that congregation is going to raise their hand.
Wow.
So that's the difference. We are in an absolute epidemic. We're really in a pandemic. You know what I mean? In an epidemic, you sort of know we can solve it potentially if we get our hands around it. We're in a pandemic. We're not really yet to the place in this situation of the 300 dying a day that we have a solution as a nation. We don't. We really don't.
Right.
Now, we have dropped a little bit in the last year, a very little bit. They're promoting the heck out of that nationally right now for probably political reasons, but we've had a little drop. We've also lost 100,000 people have died, you know, so part of the supply chain has died off, and that's why the percentage has dropped. But we dropped a little, but I can't imagine anyone would stand up and say we have a handle on this epidemic, on fentanyl overdose. Right?
Yeah. So what makes the opioids so addicting and so dangerous?
Well, you know, I'm in recovery for a long time myself, and I can tell you that an opioid has a unique property to it. You know, it has a mind change. An addictive quality that when you take it for any length of time, very short time, then you suffer withdrawal if you don't have it. Okay? Which is simple flu you've ever had in your life. That's the best way I could explain it, with severe depression. So, and I thankfully I didn't ever do fentanyl or heroin. It wasn't around when I got clean, but I did do opiates. I did do Tylox, Percocet. And I could tell you that, you know, when you stop, you know, the next morning you get up, you're so sick, you almost do anything to fix that. So let's take what used to be 25 years ago, and the potency of fentanyl is 100 times the potency of even an oxycodone. So when you start thinking about that, when someone crosses that line, and really that line is a first use, they can't stop without help. They just can't do it.
Wow.
And I've heard a lot of people say, well, yeah, you know, they can. They can't. I mean, they really can't. I don't know anybody who does that. I don't, I treat hundreds of people, and I've never had anybody walk into me and say, you know what? One day I just said, yeah, I'm not going to do that today. It's usually jail, overdose, you know, some catastrophic event usually gets somebody into help, and without that, they don't quit. It's too powerful.
Wow. So
I had a guy describe,
yeah.
I'm
Go ahead.
sorry, I had a guy describe it. I thought it was really, I wish I had came up with it. I didn't, but he said you imagine yourself being underwater, about 10 feet underwater for a minute, for 60 seconds. How bad you want to get to the top and take a breath. That is a fentanyl addict without fentanyl.
Wow.
They're going to go get fentanyl. That's what's going to happen if they're not in jail or not dead.
Right. So can you share some specific life-saving initiatives that Reach United is proposing? Now maybe it's what you've described already, but
I'll mention it again because in clarity, what we feel like is because that overdose reversal drugs are not that much in the mainstream population. Meaning, if I walk into a restaurant and say, how many folks in here are carrying overdose reversal drugs? I'm sure way less than half the restaurant will raise their hands. And I would say probably not even half the restaurant would understand what I'm talking about. If I said, how many folks know what naloxone is? They're not going to know. So we have to launch a national campaign to bring that to the forefront, to say this is a life-saving drug. You should carry it. So we're advocating putting up billboards. Like I said, we're working with the Titans. We're working with a handful of other celebrities. We partner with a group called Fund Recovery, F-U-N-D, Fund Recovery, Ryan Kane and his team, and they're real involved in celebrities nationwide doing different things. So I think bringing to the forefront, to the national attention, that naloxone saves life. Having an overdose reversal drug on you, somewhere around you, saved lives, very easy, squirt it in somebody's nose. That's number one. That's beyond number one. That's paramount to anything else. And that's why, we have this 25, 25, and 25. So we are we've got a couple of resolutions by some Congress and some local states that'll be coming out soon that push the overdose reversal. I mean, the opioid abatement councils that request them, require them to use their money, their pools of money, to go out and buy vending machines, go out and talk to Walmart, to CVS, and say, let us put vending machines here, and then get some superstar on a billboard saying, hey, I carry naloxone. Do you? It's right over here at the convenient market. So that's number one, and that's the biggest effort we have today. And I think if there's a second that we're working on is working with some folks to put out what we call short-term respite beds, which would mean in a town, we would work with that town, and if they had empty beds in the hospital, maybe we could help them put a couple of beds together that when folks need help, they could get help there short term for 23 hours, 24 hours, and then they would meet with a caseworker and see what else to do. Because there's so many people that when they make a decision, for example, in the state of Tennessee, they make a decision, I want some help. Well, they don't have insurance, they don't have some way to pay for it, they get put on a waiting list.
Right.
So when you have half the people using fentanyl eventually overdose and die, you don't want them on a waiting list. You want them somewhere getting help. And we have a project, we're working with local halfway houses, recovery residents, to also work with their associations to help them put together respite beds, so that a halfway house today, which normally houses folks after treatment, many years ago, I've had tons of halfway houses, and our main focus was always after you got out of treatment, come to us. But now we're working with halfway houses to say, give us a couple of beds. Let us train your folks. Let us get with a physician that can get somebody on Suboxone or Subutex, get them off the street, put them there for the night, come the next day, do with a case manager, and then help them find the next level of care. That's the two main things, beds and meds, that we're working on.
And certainly the beds are an enormous component of this. I wanted to ask you, though, you mentioned something earlier on when we started chatting just about the political connections that are needed. Can you talk a little bit about those inroads and those relationships you're making with the politicians, and how has their response been?
Well, I think overall good. And to make a long story short, without getting too into it, if you look at our advisory board and our co-founder with myself is a gentleman by the name of Jim Murphy. And if you read a lot about Jim's a unique guy, a phenomenal guy. Jim was involved with Bob Dole's campaign, Mitt Romney's campaign. He was involved with Donald Trump's campaign in 2016. Ran the Republican convention for 2 or 3 years. I mean, he's a very long-term guy on the Hill. He also ran the DCI group, which is the largest consulting company in America out of DC, and had AT&T. And so we've been using a lot of Jim's relationships to build coalitions. Patrick Kennedy joined our advisory team, Jerome Adams. So we've used people's relationships to get meetings with folks who are in the political spectrum, and we're early. We're just a year into this, so we haven't really got like, okay, this law's coming out, but I think what we have been able to do is get the attention of a lot of politicians, and not just get the attention, but look at very specific things we could do. We have a congressman, and I won't mention it by name because we haven't released it yet, but he's putting together a joint resolution that we think will get signed by both sides, again, that says that the opioid abatement committees should spend 25% of their money on overdose reversal drugs. We have a state representative in the state of Tennessee who's going to do the same thing. So we are reaching politicians. We are reaching organizations that can make a difference through the political connections we have in reach. And if I was going to sell Reach as a unique organization, and I mentioned it when we first started talking, that Reach combines a group of experts working in this space with a group of folks who've worked with politicians on the Hill. And I don't know this as well, even though I've been involved a long time and had political things go on. But it's a very complicated process, right? And as I'm sure you know, and being in the business you're in, I mean, you can know a politician, you can know 20 politicians. But if you don't know how to maneuver around in the different, you're going to waste a year of your life. And I think what we have is a group of guys, group of men. If I say to our team, especially Jim, we need a resolution on XYZ, how would I do that? Well, I don't know exactly how to do that. I would guess, go here, do this, do this. Jim will immediately go, no, wrong answer. You go talk to this guy. He's taking it over here. Let me make 3 phone calls. It'll go here, here, and here. We'll get it done. So that's the uniqueness of Reach that we think we can bring to the table.
Oh, that's great. That's good. Now, so we talked about the politicians. I'm going to ask you about the parents who are kind of, you could say they're the front line. What would you say or counsel parents about if their children are involved in sport or some other things and maybe some red flags are popping up? What's the role of parents in nipping this opioid crisis in the bud in terms of their homes?
Well, I go back to what I said earlier. I think it is, it's like any epidemic, pandemic, any horrible thing. We have to look at it and we have to own it and we have to talk freely about it. And it's not them anymore. You know what I mean? It's not those people over here. And I think if I'm a parent, as hard as this is, it was years ago, 25, 30 years ago, to talk about sex to one of your kids. I mean, my goodness, might be brought in front of the Baptist flogged or something. I'm joking, but
Of course.
Now it's normal. Now parents have that conversation. We normalize those conversations. We have to normalize the conversations that we have an epidemic in this country where 300 people are dying a day who were basketball players, football players, cheerleaders in high school. And their mom and dad, I'll guarantee, there's no telling how many funerals that I've been involved in. And parents would tell me, 5 years ago, she was valedictorian and was a cheerleader. How did this happen in 5 years? 5 years. So we have to have those conversations at home and say, this is a serious matter, and be prepared to talk about that with our kids freely. And I'll tell you this too, is, you have a lot of people dying from putting a syringe in their arm that has fentanyl in it. It kills them. But you also have a lot of people dying that are freshmen in college, and even though this is bad, but want to study for a test, and somebody says, hey, I've got an Adderall. You want to take an Adderall so we can stay up all night and study? Well, guess what? Adderall has been pressed and laced with fentanyl, and they die of an overdose.
Wow.
So, we have to, I know, and I appreciate you having me on, but I think we don't understand. Some people do, but not as a mainstream population.
Yeah.
That we have a drug that is being brought in here by China, Mexico. Precursors are now being shipped in here, mailed in here, and we're losing 300 people a day, 7 days a week. And we're losing young men and women, 65% men. All of the age, all would be the people you would recruit for an army.
Right.
And we're not talking enough about what that's doing to our population, to our society. And to your question, what can mom and dads do? They need to be sitting around the dinner table and saying, hey, you may not do this. You may not even know anybody that's doing this, but this is not, smoking pot 5 years ago or going out on a Saturday night and drinking. This is taking the very lives of the people that a lot of our kids are around.
Right. Well, and with your description of this, it causes me to realize that there's no reason other than this, for very good reason, I should say, that Donald Trump is making waves with his tariffs for both Canada and Mexico to prevent these precursors and these finished products from coming into the nation. What's your take on border security in regards to this?
I think it's fantastic. I'm glad. I think it is a wonderful step in a great direction, and I'm thankful for that. And the administration is looking, is acknowledging that. I think that's a step in the right direction. I think we need to. I met with a guy the other day. I won't mention his name either because I have his permission, but he is advocating some things with the mail system. We don't check a lot of packages. We can't. We don't. It's hard to, look at how to do that. But he was telling me, he said, "Hey, why don't we use AI and figure out where the highest overdoses were in a zip code? Cross-reference that with the hospital visits. Cross-reference that with this and that, and then we put a system together. We're checking all of those packages infrared. So I think we need to stop it at the border." As best we can. We need to stop it at the mail as best we can. But I'll say this also, that the demand is so high. Does that make sense?
Yep.
That we have to do something about the demand, and we have to keep the kids alive to fight the fight. And we have to treat people. You know what I'm saying? We have to make it be known that when we live in a country, you think about this, and we have healthcare problems everywhere, so I don't I don't want one of your listeners or watchers to think, he doesn't understand that I have diabetes and I'm struggling getting meds too. I know that. I'm your biggest advocate. We should have health care for everybody, is what I think. But at the end of the day, when in a state like Tennessee, we have 11 young men and women dying a day, and 5 of those are on a waiting list to get in treatment. So think about that for a minute. That would be that would be like 11 people showed up at a hospital with their left arm numb, out of breath, sweating profusely, throwing up, migraine headache, holding their chest. They're having a heart attack.
Yep.
And the hospital will go, well, you know what? 6 of you, come on in. No question you're having a heart attack. 5 of you, can we get back to you in a week or so? We may have a bed. And they die in the parking lot. And do you imagine if that happened one day in this country? One day. You would have a protest in that city. You would have the hospital, the hospital administrator fired. You would have some lawsuits everywhere. The mayor, you'd be on CNN. You'd be on Fox News. But we don't do that. We don't do that. Those 5 people, the only people that really deal with that death is their moms, their dads, their grandmothers, their brothers, or sisters. So not only do we need to stop this at the border, stop it coming through the mail, but we need to open treatment beds for people and be able to talk about this as we have an epidemic and a pandemic in this nation that is taking 300 lives a day of people under 30 years old, 65% men, that we can stop this.
Wow. Well, very important conversation, George. And from our collective lips to God's ears, may this money be used in the appropriate and efficient way. And sincere thanks for you joining me today to talk about this.
Michael, thank you for even having the willingness to take the time to put something like this on your show. You yourself doing that are saving lives. And
Amen.
Somebody's going to hear your show and say, okay, I got a problem, my kid's got a problem, and ask for help because of you doing this. So thank you.
Good. Yes. Well, and God bless you and your mission.
Look, can I give our website in case somebody...
please do. Yeah.
Okay, it's called thereachteam.com, thereachteam.com. And there's numbers on there. You get a hold, again, my name's George Massengill. I'm pretty easy to find, and you've got my information. If one of your callers
we'll put it out.
Calls in and says, hey, I know somebody needing help, you tell them, email George. I'll find you somewhere to go.
Great. That's good. We'll be sure to put that out and share the information with everyone.
Thank you, Michael.
You bet. And I want to thank our listeners, too, for watching and listening, and ask that you share this with your friends and family members who need to hear this important conversation and who need help with addictions and finding the treatment they deserve. I'm Michael Klassen. Thanks for joining us for this important conversation.